Today's video is going to be about my port, why I got one, and how it's going to help me.
My name's Olivia, and I am free.
Today I have my port placement surgery, and then I am coming home to recover. I'm not sure how this port thing is gonna go. I don't know if they're gonna put me to sleep or not, but I really hope they do because I watched the surgery on YouTube and it looked really painful. So, wish me luck. I just got back from the hospital. The surgery went well. I was having lots of dreams, and it was kind of weird because they sedated me, and like I could still hear them, but I was dreaming at the same time. Like, I don't know, it was just really weird. And then I had an allergic reaction to the Narcos that they gave me. So then they had to give me IV Benadryl because that was not pleasant. But I wasn't in pain whenever I got out of surgery, but I'm in pain now. It's not like horrible, but still does not feel very good. So I'll show you where they put port. So this one's my port, and then this one is like where they put the catheter in, so the tubing, and like it goes all the way in here and like down to my heart or something. I don't know, but I'm really tired, so, and in a lot of pain, so I'm probably just gonna sleep. But yeah. Oh yeah, also, if you're wondering what's on my head, it's an ice pack. I have a really, really, really bad headache. So, but I don't like resting or staying in bed. I'm not very good at resting because I just want to I just want to go do something. I don't like staying in bed, but it's okay because resting is a part of being able to get up and go do things, because if I don't rest, I won't be able to. So, it's all good. It's okay. I just have to remind myself, if I want to be able to do things, I need to rest. And also, I'm just really happy that this is all, like, done and over with. And things should be easier now that I have the port. Yesterday I had my port placement surgery, and so far everything's going pretty good. I was in a lot more pain yesterday after the drugs started to wear off, but after getting a good night's rest, like, I'm not in that much pain. It's like hard to move this arm and to like turn my head, but other than that, it doesn't really hurt. But during the surgery, they didn't put me under general anesthesia. They just they gave me injections, like lidocaine, I think, to like numb the area, and they gave me fentanyl and some medication to sedate me. But I was allergic to the fentanyl, and so I started to go into an allergic reaction like while they were doing the surgery, but I was asleep. But when I was sleeping, I could hear the doctors and I could hear like everything around me, but at the same time I was dreaming, and my dreams weren't even like related to what was going on around me, but I could still hear everything around me. So it was weird. Like I was having a dream. This is the only dream I remember, and it was like multiple dreams back to back, kind of like flipping through channels. But um, the dream that I remember, I was like outside with my sister, and she's 18. We were outside playing with water guns, and she had like squirt me in the face, and it was weird because I heard what was going on in my dream. So I heard us like talking to each other and playing with water guns. But then when she squirted me in the face, I kind of like jerked back, and I was afraid that like I had jerked back in real life because I could hear the doctors and everything. And like I was afraid I was gonna mess them up. But it was weird because then like right after that, my oxygen started dropping in real life, and my heart rate started going up to like the 150s. And then my oxygen was in the 80s, and the anesthesiologist was like, she has a heart condition, and her heart rate's jumping, but her oxygen's dropping too. And I could hear her like talking to the doctor, and the doctor said, just wait, keep an eye on it. And then she said her heart rate's still going up, her oxygen's still dropping, she's having an allergic reaction, I'm gonna push 50 of Benadryl. So she gave me Benadryl, and it was weird because I was still dreaming, but I could hear all this. And after she gave me the Benadryl, like it took a while for the reaction to go away, but then it went away, and like everything, like my heart rate and my oxygen returned to normal. And then like after the surgery was all done and I was back in the recovery room, then like I could hear then the nurse came in when I was waking up, told me that I had an allergic reaction, and like all that happened, and that they had given me Benadryl. So that was really weird. But like I said, it wasn't general anesthesia, so maybe that's why I could hear them, because I was just sedated. But it was still like super weird. Okay, that's it. That wasn't too bad.
And cleaning it, it's just like you would a pig.
Mm-hmm.
We'll use 3 of these. Okay. Does that feel okay? Does it burn at all in the incision?
No, that feels okay.
Okay. The little piece is about to come off. And let that dry. You don't ever want to leave it. Just let it dry.
Okay.
Same thing as a pig. I think the main thing with doing the port accesses is making sure that you have all of your stuff out and ready, so that you're
you don't already have your sterile gloves on, and then you're like, oh crud, I forgot to open the package, or like using the sterile the vials. Asking your patient if they'll hold it for you while you try, you know what I mean? Alright, so you're gonna feel a little poke, okay? And try to push into me a little bit, okay?
Okay.
1, 2, 3.
Oh, that wasn't bad.
Make sure that we're in.
Should you have any blood return or no?
Yeah.
Okay.
Yep. See, good blood return, so we are in.
Yay.
I'm just gonna let that dangle there for a second and get your bandage on it.
Do they make any other versions that lay flatter if they're going to stay accessed?
Mm-mm.
Uh-oh, that's on my pasty.
Oh. It's okay. I'll let you work at that. And this part should, do you want this part at the bottom? This is kind of up to you. It helps kind of secure that bottom. And if you want, you can.
I can unstick this.
Okay.
Okay.
There you go. Next time we'll just move this up a little bit more
Okay.
for you. Okay. And that's all there is to it.
Okay.
Cool.
Yep. And then you'll just leave it like that. And then when you go to de-access it, you just you can take off your mask now, it's all covered. You'll take off this part down here first. You might have to use some alcohol pads, and you can kind of lift up the bandage a little bit and rub the alcohol to kind of help loosen the bandage.
Okay.
And then you'll take off the big part, and then just kind of do what I did, hold around your port, and then these things right here, they will fold back. Grab a hold of them, and then you just yank it out.
Okay.
And if you need help de-accessing it, or you want to see it the first time, just give us a call, or you can give her a call if you have her number, and we can get an appointment set up for you.
Okay.
That way we can come out here and walk you through it.
All right. That sounds good.
And then it's okay to have, looks like I don't think you have any end caps, but that's okay.
Oh, are these end caps?
Those are for the IV tubing. They're not for this. So when you
Okay.
go, like if you go to access this or hook up your fluids, which she'll teach you how to do that, just make sure you clean this really, really good.
Okay. My hematologist decided to order a port for me because I have postural orthostatic tachycardia syndrome, and then I also get low potassium, low phosphorus, hypoglycemia. And the port will help me because I have to get a lot of IVs, and whenever I get IVs, my veins blow my veins roll. They're very tiny. It's just hard to get them and hard to keep one. There's home health that comes to my house, and they are able to do labs and bring over any sort of infusions based on my labs. And for me, I've already tried lots of different medications to help with my POTS, and the medications and the traditional methods used to treat POTS have not worked for me. And also, like I said, I have to get other infusions, and I have malabsorption issues, so my stomach doesn't absorb the medication that I take orally, so it's easier just to inject it. And so I will also be able to do like medications through my port. The infusions, we found out, were going to be a problem because they have to be refrigerated, so my parents had to go out and get a fridge since our refrigerator is always full. And then there was also this in there, which this is heparin, and this is a blood thinner, so it prevents like blood clots from happening in the catheter of the port. And then these ones are my non-sterile syringes, and these are to do flushes and that sort of thing. And then these ones are my sterile syringes, and these are for when my port is being accessed, then this can go on the sterile field, which is a sheet that has to be laid down to put all the supplies on, and if the outside of the syringe is not sterile, it will ruin the sterile field. So they're the same thing as these syringes, but they're sterile. And then I got some dressing change trays, and these are for if I want to, say if like my dressing gets wet, or the next time my port is accessed, then it has just like all of these in there. It has the needles. Well, actually, this doesn't have the needles. It has, what else? Oh, it has sterile gloves in it. It just has the sterile field, all that sort of thing. And then got some tubing, and this is all of this, and it runs all the way into the pump. And this bag is really cool because I can have it zipped up, and still, if the pump starts beeping, I can fix the problem because it has this little window where I can open it up. And then it has my fluids in here, and that's where the tubing ends. And then what else did I get delivered yesterday? Oh, my biohazard container, and this is for used needles or anything that may have gotten like saturated in blood. Then I can put it in here, and they put a special box inside of this box for me to mail this whenever it gets full, so I don't have to worry about where I'm going to dispose of it. And then what else? Got gloves, of course the backpack and the pump came that I just showed you. These are non-sterile gloves. Like I said, the dressing change packages come with sterile gloves. And then I got some extra caps. Like, these are for the end of my port when it's accessed. And then I got some red caps, and these are for if I need to stop my infusion, then I can cap it off so it doesn't get germs on it and get infected and all that sort of thing. I'm not sure what those are, but it also came with some tape, and I think these are some, like, I think they're clamps. I don't know, my nurse didn't tell me. Yeah, pretty sure it's a clamp. And then I got, oh, of course, the needles to access my port. And these are this part of the port. The port itself lies under my skin, and there is an access entry, and it looks like a little bump under my skin. And then there is a catheter that connects to the port, and it runs from the port over my collarbone, and then it goes down into my right atrium of my heart. That's why there's like different things for everything, because everything has to stay extra sterile, because this, like I said, runs straight into my heart, so whatever infection that could happen in here would kill me. So we have to just keep everything super sterile. I have to be super careful. I do not access my port myself. I eventually want to learn how to do that, but as of right now, a nurse comes to my house. She'll come out like once a week and to access my port, so I can do my infusions throughout the week. And what else? I think that's about it. Thank you guys for watching this video. I hope you enjoyed it. Give it a thumbs up and subscribe if you did. I always have new information out there. I think my next video is going to be about my appointment at the Neuroscience Center and what's going on with that. So if you want to watch that, subscribe and you'll find out when the next video is coming up. That appointment was just yesterday. Been crazy hectic with appointments, but I'm also going to see the geneticist tomorrow, so you guys will find out about that as well. That'll be a future video. Thanks for watching. Bye.